Hello and welcome to another episode of Health Beyond Borders, brought to you by MHTC, Malaysia Healthcare Travel Council, with Mahkota Medical Centre today. I'm your host Afika Jalil, and today we're exploring about something that may surprise you: the powerful connection between your gut and your mood. That's right. We are talking about how your stomach might just be controlling your state of mind. Joining us today, we have two fantastic guests. First, from the world of medicine, we'll welcome Dr. T. Ruben Raj, consultant in Gastroenterology, Hepatology, and Internal Medicine. Welcome, Doctor.
Hi, Rika.
How are you?
I'm doing well.
I'm great. I'm great.
Okay.
Okay. And alongside him, we have the voice behind the vision and outreach at Mahkota Medical Centre, Miss Carrie Chu.
Hi, Tika.
Hi, Director of Marketing, Branding and Communication. Hi, Carrie.
Hi.
Great to have you here.
Thanks
You
for
look
having
so
me
pretty
here
in
as well.
purple.
Thank you
yeah.
so much.
Okay. And before we start, we need to get to know each other first. So let's start with Dr. T. Ruben Raj. If you don't mind to share about your background, or how long have you been working in this industry?
Well, I've been working in medicine now for about 25 years. Okay. I studied in Ireland. Graduated about 25 years ago. I worked there for a few years actually, and also did some gastroenterology there. And during my stay there, we also spent a few months working in Gambia for some third world experience. I came back to Malaysia about 20 years ago, and I've been working in the government system. Then we did our training in gastroenterology, which takes about 4 to 5 years. This includes a training stint in Australia for 1 year for some a bit more specialized training. And I've worked in Sabah, I've worked in different areas in this peninsula. So got a good idea of what healthcare is like in Malaysia. And after that, over the last 8 years, I've been working in Mahkota Medical Centre. I decided to move from Klang Valley to a small town, see what life is like in a small town. It's been pretty good so far. Our hospital has been good to work with, and we have a lot of international patients, local patients, so it gives a good variety to our everyday work.
Okay, thank you. Thank you, Doctor. Okay, let's move on to our next guest. For Miss Carrie Chu, Director of Marketing, Branding and Communication. Miss Carrie, if you don't mind to share about your background, how long have you been working at Mahkota Medical Centre, and what do you think about this, your career?
Thank you, Tika. Thanks for having me again. Definitely for me, I've been working in pharmaceutical industry and FMCG industry for the past 20 years. And in Mahkota Medical Centre, I'm very grateful, just like Dr. Ruben, moving from Klang Valley to the UNESCO City of Malacca, which is a World Heritage City, right? So I've been working in Mahkota Medical Centre coming for a year. So it was a fantastic journey, right, from Klang Valley to the World Heritage City, where it have a very strong mixture of experiences. For example, that in Malacca itself, I would say you can really enjoy the traffic with a good hospital services around the World Heritage. Yeah, so like example, Mahkota Medical Centre is just walking distance across all Jonker Walk. Enjoy all the nice food, Nyonya food. Example, I really enjoy working in Mahkota Medical Centre, and at the same time offering this world-class healthcare with a medical tourism hospital for our international patient as well as local patient.
Okay, and let's break the ice a little. I have a couple of fun and insightful questions for both of you, and let's start with Miss Carrie.
Yes.
Okay, have either of you ever had a hangry moment that made you realize this gut mood connection is too real?
Definitely. Like for example, if you are hungry, definitely you're not in good mood.
Yes.
Right? So as a marketing, we always will treat our guests when we want to host, for example, a continuous medical education for our doctors, even a public health forum. We want to make sure our guest is well fit before we start the event, so
Yes.
they can concentrate on the topics of discussion.
Yeah, and hangry is actually, you can see also from the baby. You know, when the baby cry because they need
yes.
their mom's milk, right? You can see that from and also from everyone
Yeah.
have that hangry
Yeah.
moment. And for doctor, how about you, doctor?
Yeah, so hangry, as the term implies, it's a combination of two very powerful emotions,
Yes.
hunger and anger. So you put those two together in the same place, it's like a nuclear bomb going off. And sometimes that happened to me. We are busy and we miss breakfast, and then by about 10, 11, haven't eaten. You're working. You can get moody. You're snapping at people. You're getting a bit impatient. Important for you to realize what's going on. It's not the people that's the problem. It's you. You haven't eaten. So once you eat something, then you feel a little bit better, a bit calmer. Yeah. So it's important for us to realize when we're getting into that mood. Or even better is for us to prevent that. By having a good meal in the morning. And we'll talk about what's a good meal.
And we can say that how to treat a woman is just with food. Nowadays, people
Dessert,
normalize.
especially.
Yes, dessert. And,
Yeah.
Okay, and what's a gut health hack or food trend you've seen on social media that just makes you roll your eyes?
So, social media is a lot of things on social media. It's very interesting. There's always good things and bad things for any entity, right? And one of the food trends that's very popular out there is this detox diet. I think everyone has heard about it. You have heard about it? Yeah. So a detox diet is a dietary plan which aims to remove toxins from your body. The theory is that we consume toxins daily from our food, pollutants, and it's a very restrictive diet. You go on only certain types of food, sometimes only juice, sometimes only fruits. You need a period of fasting, okay? In fact, I'm surprised that these people don't get hungry with this diet. Okay, but there's no real proven benefit of such diets. Okay. Our body needs its variety of nutrition. Our body needs to eat, and our body already has its own system to remove toxins, our liver and kidney. Okay. So people might feel better on this diet sometimes, but it's mainly because they have reduced their calorie intake. They're not eating so much unhealthy food. But the results are usually quite temporary. Once they go back to the normal diet, they get back the weight gain, they get back the lethargy. So it's more important to have a well-balanced diet and lifestyle than going through these crash course diets.
So we have a very good-looking doctor here. So how you maintain? If you don't mind to share your age, because you look like younger, you look healthy. So you represent gut, healthy gut.
Yeah, well, I wish I knew that secret. Then I would look maybe 25. But it's a lot to do with having a diverse activity and diet. Okay, diverse having doing a lot of things. I'm 49 now. Okay, but like most people, I think when we are young and we're active and we're strong, we don't look after our health. Okay, so we do a lot of things that's not good for health. But over the last maybe 5 to 10 years, most of us realize that our health is important. We realize that we're not invincible. We can't just go eat a mamak at 2 a.m. and go and sleep after that. That doesn't work anymore.
Most people nowadays do.
Yeah.
At 2 a.m. I saw people still at the mama and eat. I was like,
Yes.
wow.
So
Teh ice, roti canai. I was like, wow.
that is such a shock to the system. So what I try to do is to have adequate exercise. We start going to the gym. You start picking up new hobbies, and most importantly is your diet. Yeah, you need to have adequate vegetables, adequate water, and adequate sleep. This kind of when you feel good inside, you look good on the outside as well.
Yes, thank you, doctor. And from both a medical and marketing perspective, why do you think gut health has suddenly become a global wellness obsession?
I think definitely global wellness exception, because everyone want to look good in front of cameras, and now social media is like a trend, right? Everyone want to appear very well, including like what rightly you mentioned, Dr. Ruben, 49 years old but looks like 30 plus, right? Definitely gut-brain axis does happen, where it's very important for us to continue stay healthy. We need to have balanced diet, and ultimately looking great, you need to actually bump up, or for example, for men, Gym is very important for lady as well. Actually, honestly, personally, I feel to be maintained healthy, especially like working in the hospital, we need a lot of stamina to work
true.
across the hospital, work with doctors, ensuring that we actually manage the patients' experiences within the hospital. So we need to manage a big team as well. We need to maintain our stamina, and how to maintain that? Definitely exercise, balanced diet is very important.
Yes, true. And I agree because I myself as a life host and content creator, I always remind myself every time bila nampak dekat scale, my weight gain, I feel like I cannot. I still need to work out and going to gym. Just now we said, okay? And we're still in the ice-breaking question. One food that shocks your gut into chaos, but people keep eating it.
Yeah, one food that we all consume, including myself, and it's difficult for us to avoid is processed food.
Yeah,
Okay.
true.
Yeah, processed food it surrounds us everywhere, and it's easy to consume. It satisfies your craving. So processed food is actually any food that's not in its original form. Okay. This can start from just minimally processed food like washed salad in a bag or frozen vegetables, up to ultra processed food which doesn't look like its original form. This is your sausages, burgers, chips. These things are really bad. They contain a lot of sodium, they contain sugar, additives, and this really puts your system in haywire. Okay. But we all consume it. Okay, we're all guilty of this. Okay, and because of convenience, it's easy.
Yeah, especially when we give our kids that kind of food. I think that is,
Yes.
I feel guilty as a parent too.
Yeah.
And let's proceed to how about you? You just now you said you like desserts. Okay, one thing that makes you know that it's not good for your health, but you're still eating it.
Yeah, definitely. I got a sweet tooth.
Same.
So I think honestly, recently I just do my health check, and it's really an alarm call for me. Yeah. Every time a lot of people feel that, slim people, you won't have cholesterol. But really, it's an alarm call for me where my cholesterol shoot up to 5.9. Although it's not that high, but to me, it's of a concern. Because all this while, my health was like very nice. It won't have like this alert. But I reflect back, how could I have high cholesterol? Because I think I only noticed that recently I have a change in terms of habit. I drink a lot of Tetarate. I can go with 3 Tetarate a day. At the same time, I like the Thai food, which is nearby my office, which is very oily in nature.
Yeah.
So I noticed that I like a lot of prawns as well, which that I think build up the cholesterol.
Yes, correct.
And eating sweet thing can convert to cholesterol as well, bad cholesterol. So I think that is definitely the moment you actually do your health check, you will get an alarm, and that is still early for me to do intervention. So now I actually do a balanced diet, right, with salad, all this. So even my friend noticed that, how come suddenly you change your diet totally? I say because I got an alarm call.
So actually, alarm call is something that important
Yeah.
for you to realize that some people don't mind about it. So a week scaling is needed to every home actually.
Yeah.
Other than that, to refer your doctor about your health.
Correct.
So a lot of people think they're slim and their weight is controlled, and they feel, that they're unlikely to have any medical problems. So this is where around the age of 30, you start doing your medical checks maybe once a year, do your blood test, do your check your cholesterol, sugar, x-rays, just simple tests. Maybe at 40, you start a bit more invasive tests, and maybe 50, you got to do a bit more. But it's important to pick up things early, so that the whole idea of medicine now or healthcare is prevention. We really should move towards treating patients in a holistic manner early, as opposed to treating them when they are sick. We want them to be healthy and avoid medical problems.
Yes. And lastly, what's the biggest myth about gut health you hear all the time?
Yeah, so there's a lot of things out there now. The biggest thing that we see now, I think, is not so much a myth, but a misconception. Okay.
Yeah.
So I'll give you an example. In gastroenterology, we see 2 groups of patients. Okay? There are patients with serious symptoms who turn out to have serious diseases. these are patients who are like losing weight. They may have blood in their stool. So they have serious symptoms when we do tests, and sometimes they have a serious disease, like cancer or ulcer or something like that. But the vast majority of patients that we see are patients who also have serious symptoms, very troubling symptoms. But when we do their tests, they don't have a serious disease. Okay, this is the vast majority of patients. An example is patients who say they have bloating, belching, what we call angin. Okay, yeah, gastric. And we see a lot of this. The bulk of our practice, we see this. We do a lot of tests for them. And they don't have any inflammation in the stomach to suggest it's a stomach problem. And they don't have any blood abnormalities, okay? But their symptoms are quite significant and very serious for them and needs to be addressed, okay?
Yeah.
And so it's important that these symptoms actually may not be related to the stomach, okay? May be related to other things like the mood, brain, the gut, the general well-being.
Is that food is including is as a
Yes.
the reason why they feel that way,
Correct.
like bloating?
Yeah,
bloating.
so food, diet, and all this. And now we are often, sometimes we're at fault here as well as doctors because we often label them as gastritis and tell them, oh, okay, you have this pain, any other sakit, so any angin adalah gastric, and we give them gastritis medicine. But actually, they're not going to get better because the problem is, a different approach. The problem is the food, the diet, the lifestyle, the stress management, and these kind of things. So that is a concept we have to move away from. That the patients have to understand that sometimes a tablet is not going to make you better. You need to change your lifestyle.
Yeah, it's very important to change your lifestyle. As for me, I was 60 after I gave birth to my second child. My weight was 70 kilogram, which is now it's 53, which is changing your lifestyle is very important. It could change your life.
Yes.
Kalau if I have to state it, apa yang doktor cakap tadi just now, the most important thing is change your lifestyle.
Correct.
And you can see the difference.
Yeah.
You can feel the difference. And the next question is gut health, such a hot topic, doctor. Can you explain in simple terms what the gut-brain connection actually means?
Okay, so the gut-brain connection is something that's been there for a long time. Okay, but only the last 10 years we've begun to put a name to it. So let me take you back to maybe school days, SPM. Okay, now you are sitting for an exam. You're stressed, your brain is working hard, you see a question, no idea what you're going to answer. Okay, this is the most important exam in your life, for your future. You guess the answer. Okay, you come out, you talk to your friends, and then they say, oh, this question, what you answer, what you jawab apa? And then they said, oh, I don't know, but I had a gut feeling that it's B. Okay, term gut feeling. We don't say brain feeling, although the brain is doing the work. We don't say heart feeling, we say gut feeling. Because that feeling, when you see B, you feel it in your abdomen, in your gut, so that itself says there's a connection. But we didn't have a term for it. This has been there a long time. We didn't have a name for it.
Is that instinct? No,
yeah, so instinct. So that shows there is a connection. So there's another example, okay, a more pleasant experience. Okay, so now I say you've done your SPM, you've done well, okay. Now you must have been very, very good looking young girl that time. Okay, you want to go celebrate with your boyfriend or your guy friend. Okay. You call, okay, he says he'll come out. All right. So now when you see your guy or girlfriend, what do you feel? You feel butterflies in your stomach.
True.
Okay. That term as well. Okay, you're looking with your eyes, you're thinking, but the feeling is down there. Okay. Which is, although it should be maybe in your heart, but you don't feel that. Maybe if you feel in your heart, then you got to change boyfriend maybe. But okay. But so that shows, butterflies in the stomach, gut feeling. This shows that we've already acknowledged that there is a connection. But over the last 10 years, there's been more research behind it. There's more data behind it that's proven this connection. Okay.
To talk about the butterfly in the stomach, right now, my husband still give me that, but blood pressure, more to like blood pressure. No more butterfly in the stomach. Okay, so we take a break for a while, and we're gonna continue after this. So stay tuned.
Mahkota Medical Centre in Malacca is a leader in Malaysia's medical tourism. Backed by a trusted track record of
More than 25 years.
Mahkota strives to be the best referral hospital in Southeast Asia. We are committed to improve lives through quality healthcare and providing you the best possible medical care. Because in the end, you, our patients, are at the center of what we do. We focus on patient safety and dedicated customer care, so you can be assured knowing your every need is met. With hands that treat and hearts that heal. Join us as we build a brighter and healthier tomorrow.
Hello, welcome back to Health Beyond Borders, brought to you by MHTC, Malaysia Healthcare Travel Councils. And today we are with our guest from Mahkota Medical Centre. Okay, and we're gonna move on with now. Let's dive into science, Doctor. Gut health is everywhere in wellness talks today, but can you explain in simple terms what can exactly in the gut-brain connection? And the answer is it true that most of our serotonin, the happy chemical, is actually produced in the gut?
Yeah, so serotonin is a very important chemical. Okay, it's called a neurotransmitter. It is involved in our mood and involved in makes us feel good. Okay, so I'm sure everybody has at some stage felt a bit low mood. Okay, for any reason. Now that's because your serotonin level might be low. Okay, and even some of the antidepressant medications target this serotonin and increase serotonin levels to make you feel good. So it's very important to our health. Right now, when we talk about nerve and we talk about all this, we think it comes from the brain. Okay, but actually 90% of our serotonin is made in our gut. Okay, the gut being mainly the large bowel. All right, and the large bowel or the gut is actually considered the second brain, okay, because it has so much nervous system. Okay, and how does the gut make this serotonin? Okay, for that we go back to the fact that our gut, especially the large bowel, has a lot of bacteria in it. Okay, bacteria. Okay, let me give you a little quiz. Okay, we have about 30 trillion human cells we are made up.
Okay.
That's 30 followed by 12 zeros. Okay, I ask you to guess how many bacteria you have in your colon. Okay,
Million, billions?
Yeah.
millions,
Billion.
billion. Okay, you say billion. You say million or billion or trillion?
Billion.
Billion also. Okay, so the number varies depending on the research, but we have at least 39 trillion bacteria. Some people say 100 trillion.
Wow.
That means you have more bacteria cells in you than human cells.
Is it good bacteria or bad bacteria?
Yeah, so it's a combination. Remember earlier we spoke about diversity and having a diverse diet. It's also important to have a diverse bacterial population. Okay, there's good bacteria, there's bad bacteria. There are viruses, there are yeast. Okay, but all these live in harmony. It's like one big garden. Okay, there are bees, there are birds. You know, there are big bees. They can bite, but they all live in harmony. As long as it's all diverse, they're all in the right amount, nothing is upsetting them. Okay, so if you suddenly you have your honey, your flowers that produce honey disappears, okay, then your bees are going to disappear, and that's going to cause a lot of problems. That same thing for the gut as well. Okay, so bringing back to serotonin, these bacteria then are involved in serotonin production in the gut. Okay. These bacteria have many interesting roles, okay? And now there've been research to prove that these bacteria play this interesting role, okay? And some of this research is very interesting, okay? Most of them involve mice, okay? So if you take mice and you colonize the bacteria toxoplasma into the mice colon, they actually lose their fear of cats, which means because of that bacteria, the mood is changed, okay? And also, if you colonize them with certain bacteria, they can develop diabetes, okay? Which means these bacteria can contribute towards health problems. These little bacteria in our colon. And they are vital for our well-being.
Okay. Thank you. Wow. Trillion.
Yes, more bacteria than human cells.
Yes.
Okay? Yeah.
And we hear a lot of probiotic and prebiotic. I believe probiotic is about bacteria
Correct.
jahat, bacteria baik.
Yeah.
Is it? And do they actually help in? Do they actually help with mood regulation, or is it just marketing hype?
Okay. So, who's consumed probiotics? Have you taken some probiotics before? You have, yeah, Carrie.
Yeah,
You've taken
during diarrhea,
probiotics?
doctors prescribe
Correct.
probiotic.
Yeah, that's the right
Yes.
way. That's the correct terms. Okay.
And usually we eat tempeh is considered as a probiotic, is it?
Oh,
Yes, correct. Yeah, tempeh, tempoyak, even. Okay.
Yeah, betul.
So probiotic is any food that contains these bacteria. Okay, these are usually fermented food, like tempeh, tofu, toase, and certain cheese. Okay, they contain this bacteria. We consume it, and the bacteria helps colonize in our bowel. It helps balance things. It helps with our immunity. Okay. Prebiotics, on the other hand, is food for this bacteria. Okay, this is food that we consume that we don't digest. We cannot digest. Okay, this is like fiber. They are found in apples, banana, onions. Okay, these
Celery?
are undigestible. Yes, correct. Celery, vegetables. Okay.
Vegetable.
Yeah, so we don't digest the fiber. The fiber goes down to our bowel. The bacteria uses it as fuel. It produces more bacteria, it produces more good bacteria, and it maintains our immunity, maintains our serotonin levels, and all these things.
And about maintaining your gut health, our gut health, and how to maintain, from doctor perspective, how to maintain good gut health.
Okay, so maintaining good gut health has many different approaches to it. Okay, firstly, there are things that we can do ourselves to maintain our good health. Okay, so to maintain your good gut health, you have to maintain your bacteria well. This is what we have found now. Okay, you have to feed that bacteria. Okay, and that means you have to eat more vegetables, a variety of vegetables. Okay, because different bacteria want different food. Okay, one might like broccoli, but another one might like celery.
Yeah.
So there's no use if you just eat broccoli every day. I was also eating a lot of broccoli every day, and I thought it's good. But then you need different types of vegetables to feed different colonies of bacteria. Okay, you also need adequate sleep. Okay, the sleep is important for you, but surprisingly, it's also important for your bacteria. Your bacteria also need to rest. They also sleep at night. Yes. So you need adequate rest so that they can rest. In the morning, they can work. Yeah, you go then makan the mama at 2 a.m. and wake up all the bacteria. Then the next day they are tired and they can't work. Okay. So those are things that we can do. The other thing that's important about gut health is called screening tests. Okay. This is where when we reach a certain age, we do a screening test. A screening test is a test that we do to identify a disease before symptoms. Okay. For in terms of gut health, at the age of about 45, you need to start doing your scope for your colon to identify early cancer and early polyps. Okay, and this is what, as gastroenterologists, we try to promote because we want to pick up these diseases early and to prevent them becoming cancer. Okay, so the age of 45, everybody, especially, doesn't matter whether they have symptoms or no symptoms, they have to go for a screening test to check the bowel.
Okay. Thank you, doctor. So actually probiotic, it's actually a gut. Our gut is manja lah.
Yeah.
Can we say that?
All the
Manja?
bacteria, yes. You have to look into it.
So it's about they can sleep, they need a good food such as probiotic, So yeah, let's proceed with our next segment. So marketing perspective from our for Miss Carrie Chu.
Yeah.
Okay, my first question is, from your point of view, why is this topic, gut and mental health, resonating with the public more now than ever before?
Yep, definitely. I think that's why today our discussion, I invited Dr. Ruben, which is a gastroenterologist, to talk about this topic. And because definitely mood and gut are actually interrelated. And with this brain-gut axis topic, right, where a lot of people are talking about it, if you look at that, right, even in the infant nutrition and adult nutrition, a lot of formulas, milk formulas were added with probiotic formulas.
True.
That's why a lot of people also confused, should I actually buy those with the probiotic or prebiotic? People, a lot of them also confused, right? That's why now the hype of this topic in the industry itself, which is driven by the industry as well. But at the same time, I think it's very important, which rightly Dr. Ruben mentioned, right? Health screening is very important. This is where, as Mahkota Medical Centre, we do have our health screening centres. That's why this is what we are promoting to the public, right? You need to do your health screening every year, right? Because for Mahkota Medical Centre, our health screening motto is your wellness journey begins here at Mahkota Medical Centre.
Wow. I was about to ask the slogan at the end of our podcast, but you dah stated.
Yes.
Tapi kejap lagi we're gonna ask it again. Okay.
Sure.
Okay. And let's move on to how is it Mahkota Medical Centre raising awareness or building programs around the gut-mind connection?
So this is where we started. Like this podcast is a first start that we actually building this program, right? And with Dr. Ruben as well, we always were actually doing more podcast sessions to educate the public. So we also have some educational content in our social media platform, which talk about good gut microbiome, how you maintain your good health. Yearly screening is very important. How you fight colorectal cancer with early screening as well. So all these like endoscopy, some critical things to actually catch it very early, especially for colorectal cancer. And we know Chinese are very prompt to colorectal cancer, including Indonesia. That maybe Dr. Ruben, you can share, right, based on your patient that comes to see you. How many percent that usually they will catch the colorectal cancer earlier with this endoscopy?
Correct, yeah. So these colon cancers usually start as what's called a polyp, which is just a small, tiny growth in the bowel. Okay, this can be removed during your scope. You know, it takes about 5 minutes to remove the polyp. Okay, and that 5-minute procedure can prevent you getting cancer 10 years from now. Okay. So you can imagine if you have cancer, then the whole treatment is different. You know, it's a long process. So a lot of these patients, if they had undergone a screening test earlier and picked up the cancer earlier, it could be been removed on the spot and prevented the cancer in the first place. And unfortunately, we are seeing more of these diseases happening in the young these days. And it's related to our topic now because of our diet, because of our lifestyle. We're a high salt diet, and we don't have adequate sleep. We're not eating well. Okay, so therefore we have to be sensitive to symptoms early and seek help early, and then we try to prevent problems.
And some people refuse to seek help because they are scared of the surgeries.
Correct,
or something that they might have to menghadapi.
So some people, they are scared to do the tests because of the result.
The result.
Yes, so
exactly,
they might,
Doctor. Thank you.
Yeah, so they might. It's already suspect they might have cancer.
But
and
maybe I
therefore-
can add on. At
Yeah.
Mahkota Medical Centre, our health screening result, actually you can get it right on the same day. So you no need to have guessing game, right?
yeah,
how
betul.
many days you have to wait for your result to come out? You will get your answer immediately. And if you really have anything in your reports, will be read by our health screening doctors, right? Then they will directly referring to the in-house specialists that Mahkota Medical Centre have.
True, because the result usually could take some time for other.
But not at Mahkota Medical
Not
Centre.
at Mahkota Medical Centre, okay? And can you share some Mahkota latest marketing initiative or wellness campaigns related to gut health or holistic area?
Yeah, definitely. I think at Mahkota Medical Centre, we were constantly doing a community outreach program, wellness program. Like I mentioned to you just now, at health screening centres, we always promote your wellness journey begins at health screening centre, where you actually come in for your yearly screening. Don't wait until you've developed symptoms, right? then you bring along your families, friends. We have actually promotional package for those health screening packages at a different variety. So depends on your age range, we will actually offer a different types of health screening. So in case you do not know what type of health screening you should go for, come forward to Mahkota Medical Centre. Our expert health screening this one services manager will actually tell you what you should go in terms of which are the packages that's suitable for you. At the same time, like what I mentioned, how is the difference between Mahkota Medical Center versus others is that you don't need to wait. Where early in the morning you come in for your screening. At the afternoon, your result will be interpreted by our health screening doctor. At the same time, if you are well, everything is good, you will follow up by our dietitian there. They can actually prescribe you a healthy, balanced diet to maintain your current health. And health is wealth. That's why I say wealth.
True.
Yeah.
Okay, thank you. And let's take a break and we'll continue after this. Stay tuned.
Mahkota Medical Centre in Malacca is a leader in Malaysia's medical tourism. Backed by a trusted track record of
More than 25 years.
Mahkota strives to be the best referral hospital in Southeast Asia. We are committed to improve lives through quality healthcare and providing you the best possible medical care. Because in the end, you, our patients, are at the center of what we do. We focus on patient safety and dedicated customer care, so you can be assured knowing your every need is met. With hands that treat and hearts that heal. Join us as we build a brighter and healthier tomorrow.
Welcome back to Health Beyond Borders, brought to you by MHTC, Malaysia Healthcare Travel Council. And today we are with our guest from Mahkota Medical Centre. Okay, and it just cannot, I cannot like buang daripada fikiran I just now. You said you don't have to wait at Mahkota Medical Centre. No wait at Mahkota Medical Centre. And yes, it's proven that our Mahkota Medical Centre, how many is Mahkota Medical Centre established pada tahun berapa?
Oh, Mahkota Medical Centre established since 1994. So it's already a 31st anniversary that we'll be celebrating by this November.
What? Okay.
Yes.
My age, I was 20.
Oh, really?
I was 32.
Okay.
So I am 32.
Oh, all right. Yeah. So
Okay lah.
at 31 years of establishment of Mahkota Medical Centre in the World Heritage City in Malacca.
Oh,
Yeah.
Okay, wow. Okay, let's proceed with, let's move on to our next question. What makes Mahkota Medical Centre stand out as a flagship hospital for international patients seeking care in gastroenterology and beyond?
Yeah, I think first of all, I would like to thank Malaysia Ministry of Health, at the same time MHTC, Malaysia Health Travel Council, for selecting Mahkota Medical Centre as one of the 4 finalists in the flagship medical tourism hospital. Mahkota Medical Centre have actually in the medical tourism since back in 1997, where we started to actually venture into Indonesia market, right? With our leadership team exploring medical tourism for our neighboring country, which is Indonesia, Malaysia, and all around the world right now, where we have attracted tourists, medical tourists, to come to seek treatment at Mahkota Medical Centre. As what make Mahkota Medical stand out, because we are always in the forefront of medical excellence, where Mahkota Medical Centre is the first hospital in Malacca that have the JCI accreditation, which is the US-based Joint Commission International accreditation for the hospital, which ensuring patient safety and quality care of delivering to our patient. So for Mahkota Medical Centre, we actually very focused on personalized care for our individual health travelers, at the same time for our local patient, definitely. Yeah. So beside that, right, recently we also acquire another 2 JCI Gold Seal Standard to ensure that we actually delivered the best for our patient. We have also been accredited as CCPC, Clinical Care Program for breast cancer. As you know that breast cancer is actually the most number one killer for women.
yeah.
Right. And more women are being diagnosed breast cancer at the very early stage. Hence, that inspired Mahkota Medical Centre to establish our Breast Cancer Centre of Excellence, where we have a program where from the discovery until recovery, we have nurse navigator to follow through with the patient. At the same time, we have a comprehensive professional team consists of oncology, even a lymphatic specialist to actually taking care of the patient in rehabilitation times, where we know right during the chemotherapies or even after the breast surgery, you may potentially having an elephant hand, where we have a dedicated lymphatic specialist to actually work with you on rehabilitation. The same time, dietitian as well, to ensure and to actually advise you on what are the proper food you should have during your journey in your breast cancer journey. So these are the things that make Mahkota Medical Centre stand out as a cancer center of excellence. Beside that, we also invest in a lot of like technology, innovation. Our hospital always have the most advancement in terms of technology. For example, we have the smart ward hospital, where there's the next generation smart ward, which is first in Malaysia. We have actually developed our in-house smart ward based on our nursing flow, where when patient come in and admitted to our ward, our nursing will actually have a comprehensive, as well as our doctors, right? Dr. Ruben, you can actually encounter how is the patient stay in our hospital with smart ward technology versus the others.
Correct, yeah. So with the smart ward technology, the patients have something similar to an iPad next to their bed. Over there they can look through their results and they can call for a nurse or they can adjust their diet request, just all on bedside, you know. And it gives some degree of independence to the patient, to look at their results, to decide what's going on and things like that. Often patients, when they come to hospital, one of the problems is people lose their independence. They feel they're not making any decisions. So with this small addition, it helps them feel more comfortable.
Yeah, the bedside terminal, you can choose your preference diet. So even the allergy, if you have any allergy of medication, you can actually indicate that, and the doctor will be actually much aware of, right? Don't need the nurses to write in the notes, then hand over to the doctors, right? For
correct.
doctors, also very easy.
Yeah, it's all
with the
on the
nursing
spot.
dashboard, by one glance, you can know where is your patient.
Yeah, so it's all just makes the process a bit smoother and easier and more pleasant journey for the patient.
So the slogan for you don't have to wait at Mahkota Medical Centre is true, because before this I was taking care of my kids at a hospital, and I have to wait for the doctor for 4 hours. You nervously wait for the results. Yeah. So I think that was a very good invention to prepare the iPad beside your bed, and the patients can check their condition or their results only through that.
Yes.
I think that was amazing because I waited. That was the thing that I hate the most, waiting especially for the results, and we need to know the condition for my kids.
Yeah,
So,
maybe I can add on the waiting time. Actually, it will be shortened. Definitely at hospital, as most of our doctors are very busy and we have very packed patient load. Waiting time is still needed, but it's just that you will be actually, for example, you just spill your coffee. You just need you don't need a nurses to actually do that. You just need a cleaner. You can just write on the button of the patient terminal. Beside that, you can just click. The housekeeper will actually straight away get an alarm call and they will immediately attend it. Even like hot water, right? Imagine during your admission, you need to call for hot water. What will be conventional? You need to press alarm, then the nurse will come to you. But at our hospital in the smart ward, you just actually have to click it, then the nurses straight away deliver the hot water for you, because you can actually order through the patient terminal itself. Yeah, that is the convenience that we give to the patient with all this innovation. Beside that, maybe I would like to add on, we also have the first in Malaysia Robotic Surgical System from Japan. Yeah, which we are actually being innovation versus the others, where we want to bring the best in class in terms of precision in surgery, innovation as well, at the same time better cost effectiveness and patient safety. So with more, I think our doctors is also all are being trained. Most of them are actually already been expert in non-invasive surgery, but now they are actually being trained with robotic surgery. So
Amazing.
patient now at our hospital can actually choose to have robotic surgery, right? Where they have actually lesser hospital stay. At the same time, they can have a quicker recovery, and at the same time, is actually more give them more option in terms of surgical option as well. Yeah.
And Malacca is rich in heritage.
Yes.
Yes, true, right?
Baba Nyonya heritage
Nyonya,
and
betul.
Portuguese. Yeah.
But what makes it ideal for healthcare travelers?
I think I would say at Mahkota Medical Centre, we are strategically located at the center of heritage building around. Yeah. So if you want a postcard, please look for us. We will actually give you the free postcard where we have a map for you to navigate around while you're actually staying. Maybe your parents are coming here for a surgery, 3-4 days. They are actually their kids can actually go around. They don't feel bored, right? They just can walk around. We have hotels surrounded us, 4-star, 5-star.
Correct,
Yeah, we have all the heritage buildings surrounded us, like A Formosa statue, right?
Yes,
yeah,
correct.
all by walking distance. Yeah, there is none hospital in the world, I would say. I'm not sure. Correct me if I'm wrong. That you can access all this heritage building at the same time. Good food, everything at the walking distance from the hospital.
Oh.
Yeah.
So the journey and experience for the international patient it can be different from a local patient, and it's something that we have to be aware of. Local patients, you want to just go to the hospital, get your disease fixed, and go back quickly. Okay, so international patients want that as well. They want to, of course, come to the hospital, get your disease fixed, but they're in a foreign land, and they also need the rest of their experience to be quite pleasant. Okay,
true.
and if you just go to the hospital, sometimes you just see the doctor for half an hour, you do your test for 1 hour, and then you go back. There's only one hotel, and you just go back and sit in the hotel. That itself can be quite a stressful
Yeah,
experience. So, like Carrie said, we are fortunate because we have things around us that can distract them. There's a shopping center, there's food, there's the heritage centers. So after the treatment is completed, they can experience these things, and also it will help them feel a bit calmer and a bit more of an enjoyable journey for them.
Okay. And I like to Miss Carrie give one slogan. Because if Mahkota Medical Centre had a tourism slogan, what would it be? Something like come for the care, stay for the cendol.
I would say at Mahkota Medical Centre, your wellness journey begin with us. Where you can actually stay, leisure, and have a beautiful memory when you go back to your hometown.
I think Miss Carrie and Doctor has answered my question, my last question, which is why Mahkota Medical Centre. But let's hear it again with the simple or the short point, which is why Mahkota Medical Centre? Because I think you have answered. The point you answered just now is perfect. But let's recap your
Okay, sure.
Mahkota Medical Centre. Why Mahkota Medical Centre?
Mahkota Medical Centre have the very great medical excellence for past 31 years, backed by our very experienced 110 specialty of doctors in Mahkota Medical Centre. At the same time, we have actually a comprehensive specialty, and as well as we are always invest in our latest technology innovation for surgery, for our wards, for most of the care that we have at Mahkota Medical Centre. Same times, we are actually JCI, US Joint Commission International. We are the first, I would say, hospital in Malaysia have the 3 gold seals of standard from JCI, which is the JCI accredited for hospital program, JCI CCPC program for breast cancer, and just now I didn't mention is the JCI, which is recent accreditation for chronic kidney disease. Yeah, where we always take care of patients from discovery, the moment they have a diagnosis of their situation or condition, till recovery with our professional care of team consists of medical professional, nursing, nursing assistant, as well as those allied healthcare, for example, dietitian, I would say.
Yeah.
Yeah.
And from Doctor, let's recap our topic today, and your last word from Doctor.
So this is a good initiative by MHTC, and it's allowed us to broach the subject of gut health and the gut-brain axis. So, we've talked today that there's a clear connection between the gut and the brain, okay? And so that means if you look after your gut, you will feel better. You'll control some of your diseases, okay? And how do you look after your gut? We've spoken about the gut has 39 trillion bacteria. The way to look after the gut is to look after this bacteria by eating the correct foods, which is more vegetables and a variety of fruits, seeds, nuts, and having enough probiotics and prebiotics, okay? Because if you have happy bugs in you, you will also be a happy person.
True.
Okay?
True. Okay, thank you, Doctor, and thank you, Miss Carrie. Okay, and it's been such a fascinating and insightful conversation. Anyway, it's perfect. This topic is very important because your gut, your wellness
Yes.
start from healthy gut.
From your gut.
From the gut.
Everything is related to your gut these days. We're finding
Yes.
out more and more.
Okay, and from how our gut can actually shape our mood to how a hospital like Mahkota Medical Centre is transforming wellness journeys across borders. Okay, Dr. Ruben and Miss Carrie, thank you so much for joining us today on the Health Beyond Borders. Your perspective, both clinical and consumer driving, are exactly what we need in this new era of holistic health. Thank you so
Thank you,
much.
Tika.
Thank you, Fika.
And to our listeners, remember your gut isn't just about digestion. It might just be your brain's secret alive. Until next time, this host Afika Jalil. See you again next time. Bye.